Welcome back to another episode of Living Vividly. I'm Jackie Heddich, your health coach.
I'm Daphne Olivier, the owner of the Unconventional Dietitians.
Our guests today, you might recognize them from a previous episode. We have Dr. Abigail Hart and Dr. Charise Fashho. Last time we had them on, we were talking about obstetrics and having babies in the hospital. And today we're shifting gears a little bit to a different stage of life.
Right. So women in their life cycle require so much concentration and focus. And so y'all are transitioning into a different part of the life cycle, right?
So tell us what's going on.
So our aim is to help women. It's our passion. It's why we went into obstetrics in the first place. And as we have evolved and we've listened to our friends and family and their complaints, I think our focus has also evolved. So we're still very passionate about our pregnant patients and maternal care across the U.S., but we are now shifting our focus to something else we're passionate about, which is all like the hormone changes and stress and inflammation and chronic diseases that we feel have not been addressed with care and with enough evidence base to help our patient population.
Yeah, I think I'm always someone that's always learning and wanting to know the best information for my patients. And we just weren't trained well traditionally with like allopathic medicine to really like do a deep dive. It's like the patient has normal labs and is feeling poorly. Like, your labs are normal. Sorry, go have a good day. Like, that's not good enough for me. I just feel like with everything that personally I've gone through recently with my own midlife, perimenopause, hip pain, brain fog, everything. I did the traditional medicine, stuck an estrogen patch on, gave it 6 months, and nothing was changing. And so I needed to do a deep dive for myself. And this is traditionally how I've always been. I mean, I went and got my international lactation certificate when I had trouble breastfeeding. I went and got an obesity medicine certificate when I was overweight. I just always want to learn the best possible medicine for not only myself, but I want to bring it to others because that's just what I decided to do with my life. And I think with OB, I always wanted to give the best care to my patients. I feel like I've been doing that. Maybe I'm a little bit bored with that. But when Dr. Hart and I kind of were like, how can we fix me? I was the patient. And so I started looking into some of the functional stuff, did some testing, lab testing, found out that I probably need special vitamins. So we did like some testing with like homocysteine and like MTHFR. I mean, this is not taught in medical school. It's a lot of functional medicine. And so as we are kind of learning, I'm like, how can we bring this to Acadiana? And so we've been kind of developing Aviva in the back corner and the back burner for some time now. And I think it's really exciting because truly I feel so much better not going the traditional medicine route and treating myself from like a root cause, that I just feel like it's an enlightened type of medicine that we can really bring to our patients. We can also collaborate with so many other businesses, women-run businesses. Like, that's what I feel the calling in my life is about now. And I'm just so excited.
Well, that's beautiful.
What are some of the challenges specific for women that are not having babies anymore, not fully into menopause, that kind of in between? I mean, it's called perimenopause, but like that in between stage. What are the challenges that you see coming up that are being kind of ignored or we don't really have great research around?
I think it's hormones in general. Like, women have not really been studied that long. When you look at medical history, a lot of the papers are derived from studies on men, and then we try to apply it to women. Women are not versions of men. Like, we are women. Own set of hormones. Our brains work completely differently. We need different nutrients.
Boy,
our
don't we know
circadian
that,
rhythms
huh?
are differently. I mean, everything is different, and I feel like the medicine that we do want to bring, it is highly evidence-based, and it's a fusion of holistic, functional, some integrative, as well as the evidence-based, more traditional medicine. And I do think this has been a long time coming. I think there's a lot of very complex interplay with stress in our lifestyles. As women, we take on a lot. We tend to put others first before us. Am I surprised that our symptoms tend to correlate with normal lab values? No, I'm not surprised. But we are looking beyond lab values. We are addressing the entire person, symptoms-based, etc., lifestyle, sleep patterns, exercise patterns, food patterns. It's all going to make sense once we address the whole person, because that is all what goes into these hormone problems. So, traditionally, I find that treating hormones has been somewhat of a Band-Aid medicine. As in, you see the abnormal lab values with the hormones. So, okay, let's give you hormones. But we're just putting a Band-Aid. Like, our bodies are crying for help because there's something else going on. So why are the hormones acting up? And that is kind of our mission and our goal. Like, yes, we want to fix the hormones, but we also need to address all the other things going on to figure out why are the hormones erratic or not balanced.
It's crazy to me that this isn't just standard, that we're not just looking at it from a big picture view all the time, but it's just not. It has not been done that way, and it boggles the mind, but I'm really excited for us to have this.
It is such an exciting time right now, actually, because there is some research coming out, and I'm always trying to stay on top of the latest and greatest, and we want to bring it here to Acadiana because the women's movement is finally starting to pick up pace. It started off in smaller circles around the country, and it's definitely growing because women are recognizing this. I think social media has helped spread the word as well. So I think it is an exciting time. I have a lot of hope and positivity and energy that we will start to see things get better, even in terms of therapy and treatment options. So
I'm sorry.
No.
What are some symptoms that people start to feel whenever hormones start to shift? And what hormones specifically are we talking about?
So our two major players, estrogen, progesterone. We also have testosterone, believe it or not, as females, but we don't make as much as our male counterparts. But these two hormones play a critical role in our lives from childhood throughout pregnancy and then in our midlife the perimenopause, menopause years. And so they're always fluctuating. They're always in flux. So I guess you can say the only constant is change, right? How you respond to them, people with PCOS or other insulin sensitivities, these are all connected, right? Fertility, pregnancy, how maybe you felt great. Some women feel great when they're pregnant, right? Progesterone's high, it's growing the pregnancy. And so then it goes away right after you deliver. Postpartum depression. These are all things I think that are interconnected. The modern women today have so much more stress going on, right? We have phones, we have all these technologies to make our lives easier, but I really think sometimes it's making it more challenging. And then we have symptoms that we can't ignore. So some of the very common symptoms of perimenopause: brain fog, joint pain, hot flashes, night sweats. These are part of a transition where I think traditionally we were always trained, yeah, it's just part of life, deal with it. Or, you can have some hormones, and not everyone wants hormones. There are ways to look into this, to do a deep dive. Is it stress and trauma related? Is it your diet? Is it deficiencies in your diet and your nutrition? Are you exercising? Are you taking time to meditate and relax? Because it's important. Every day I feel like I'm always on a schedule, on to the next thing. And I think slowing down actually helped me. And so I think being able to spend time with patients is what I'm looking forward to the most. I think in a traditional medical practice, you're so bound by, sticking to the insurance plan and is this covered, and 15-minute time slots and doing a whole annual exam in 20 minutes. And it's just not good care. And so I think with what we're trying to do is really spend time with patients, because I miss that being an OB hospitalist. I'm really always on the go. And I think I found beauty in slowing down. And I think we all can learn from that.
So what is the Eviva? Is it a primary care? What are we?
I think we're calling it a health club, right?
Yeah.
It's a health club. It's a vibe.
It's a vibe.
We keep saying that because we want people to come in, and we want there to be community, right? I want there to be relationships, again, with local businesses. I want to refer out for IV hydration therapy. There's a bariatric center not far, hyperbaric center, really close to us. And so, again, working with other practitioners in the community, longevity medicine, people are really coming out there to not only support women, but also men. I think this is an overlooked type of medicine. And I think Aviva is going to really, it's going to develop, it's going to grow. So I don't think it's one thing right now, but we are, offering more of a root cause analysis, non-traditional treatments for some issues, right? Like vaginal dryness. There are some things you can do, not just hormones, that we're going to get into. I think our experience as OBGYNs, our surgical experience, our experience personally through what we've been through with our own health issues, we're going to bring it all to Aviva.
Let's just say I am looking for better care. I'm a woman, obviously. Why would what is the appointment that I make with you? Is it just like, I want to talk about all the things and figure out what the plan is? Or do I have to have, these are the 5 things that we treat?
It can be completely conversational. I mean, when our patients walk through, I want them to feel relaxed. It is not going to give medical clinic vibes at all. Everything that I think we want for ourselves is what we want to give to our patients. So, if the visit veers off a little bit, like let's say they were just here for hormones, or they thought they were, and then we start uncovering some other things, well, then we can shift the focus to that. And I want it to be more of an organic, more of a natural type of conversation sort of visit, because I feel like that's when patients can really think, gather their thoughts, not feel rushed. They don't have anxiety. They can sort of guide the visit. And then even if they're not sure what they need, because how many times you go to the doctor and you're just like, I just don't feel right. Tell me what's wrong. Like, we're going to uncover that. It may take more than one visit, but...
And we're going to stay true to our 5 pillars, right? With what we're learning with this functional medicine, integrative medicine, is that everything's connected. It's not just as an OBGYN, you're trained to look at the ovary and yes, the ovary is the problem. Now it's the thyroid is actually connected to the gut, connected to the adrenal glands, connected to the ovary, and putting it all together. And I think that's the type of medicine that Aviva will offer. So our pillars will be, gut health, with nutrition, referring out to excellent nutritionists, gut health, hormones, weight management, weight wellness. The GLP-1s are actually pretty groundbreaking in terms of, I've been working telemedicine with Weight Watchers for the past 2.5 years now. So it's given me a lot of experience to bring something to the community. I mean, I love the results that my patients are getting. I love seeing a before and after picture, but telemedicine is just not enough for me. I really miss the connection with patients, and I'm excited to bring the weight management. Dr. Hart also has her ABOM certification too. And so I think we'll be able to offer weight management, also detox. It's so important to detox, and from a physical level and a mental level, I think that we can offer that. We're going to have a sauna at the space. We'll probably have some red light therapies, a lot of innovative treatments that I think will make this health club vibe really something to come to fruition. I'd love to have 5 Mile, cater some food. We have so many ideas that I think will come together. And I think the networking and the connections that we've made over the past 6 months even, I'm just so excited.
Yeah, so my hormone situation started with, so I'm fully menopausal. Hormone situation started with my thyroid, and it took not as long as most people deal with thyroid issues, but probably I'd say a year or so of trying to figure out what was going on. And I have Hashimoto's, and so that was the beginning. Maybe I want to say 12 years ago. I don't remember exactly. That was the beginning, and then that introduced me into, a handful of years later, just the very beginning of the quick downward spiral. And so there were times in that whole menopausal situation where I literally thought I was going crazy. I don't know exactly what was happening. Clearly hormones were not balanced. That was also kind of in the middle of COVID stuff. So there was a lot happening, and stress was really, really high. But I thought for sure I was going crazy. And 100% surprised that I was still married and had friends, because I was like, I don't know why my husband would stay here and deal with this, because it was so much. It felt like so much. My friend assures me, some of my friends I was hanging out with them this weekend, they assure me that they didn't see it or notice it. So it was a lot of internal, emotional chaos. And that's not my norm. I'm usually pretty straightforward. So the need, and I feel like I found some good people along the way that were just kind of starting to get involved with this. But the need is so high because we don't know, like when there's chaos, internal chaos going on, you don't even know where to start. So I think it starts with practitioners that are asking the right questions so that you can start to put the dots together and connect things, and then you can, it's an unveiling, so to speak, of what's happening or what you feel like is happening. And but it starts with being able to have someone ask questions that we didn't even know that we needed to be asked.
Right. Like we were trained, just check a TSH, the thyroid stimulating hormone, which is a pituitary hormone, and we're not checking the actual T3, the conversion from T4 to T3. Like there are so many labs that a traditional OBGYN, myself included, was not ordering. And now that we've kind of had this unveiling or enlightenment, it's like we need to bring this to other people.
And I think too, like I'm really big on stress and inflammation as a primary driver of chronic disease. And then taking like my personal experience and realizing how bad inflammation and stress are for other bodily processes. And then finally getting some of my functional testing done and seeing that my cortisol was completely flat. So, I mean, the proof is there. It just took some time, I think, for technology and medicine to kind of get there and show us some numbers, because for me, I am a numbers person and I do like to track things. I want to know, like, are these diet and lifestyle changes helping? And we kind of realized that by teaching ourselves relaxation and not being go 24/7. It was, I think once we started to do that, other things started to fall in place.
Yeah. So in my case, and again, I can go back to my case, and then, I mean, I don't work in the same space with hormones and stuff, but I look at all of those things too. So when we're talking about, like, the beginning parts are changes in thyroid. So thyroid, insulin, vitamin D, that little trio that is so important in setting you up for the estrogen progesterone changes. And so we have measurable ways to be able to look at those things. And so if we can track them and we can look at them, we can really set people up for having the best case scenario. So none of it's easy or fun. I do have one friend that went through menopause and she just stopped having a cycle and she was like, okay, everything's fine. She is literally the only person that I know that has had that situation. But if you can set people up for before they start the change in hormones by supporting the cortisol and the insulin and the vitamin D, getting all of that in place and getting those lifestyle factors, and of course the food. I mean, I'm always going to talk about food, but the lifestyle factors in place first before they go down this path, it makes life so much easier. So much easier.
And it's those little connections that I feel like traditional medicine, or where your office visit is 15 minutes and then you're out the door. It takes more than 15 minutes to establish those connections and do a deep dive. It's very, very fixable, though, is the thing. It just takes some time.
And it takes learning. Like, you guys are obsessed with learning new stuff all the time. And I feel like some providers are just comfortable with what they know, and they don't feel like, so I've walked into appointments before with some functional labs that we've done, and the provider just won't even look at them because they don't understand them. That's not in their little wheelhouse. And I've been told that, oh, this is not based in science, or whatever the case is. If they don't fully understand something, they're not even going to try to talk about it or review it with you. And I feel like a lot of women especially, but people in general, get gaslit in these medical and like you said, the allopathic testing, it doesn't cover everything that you need to cover. I've been feeling like crap for years and doing the normal blood work every year, and everything is sort of within range. I have low vitamin D, and all my thyroid function is completely normal, so everything's normal. But then I have to go do like Mark Hyman's function testing that's not in my doctor's office to find out that my antibodies are off the charts, so we're just trying so desperately to find the answers, and these functional tests are really where we're finding a lot of that.
And the utility of the functional testing is that because we're testing for this stuff and we're looking to see what's wrong, it's fixable, which is amazing. We're not just testing just to test. We're trying to figure out why are these two labs normal, but you still feel this way. And maybe it just takes one extra test, and then that's the clinical picture, and that's going to help guide us henceforth.
Mm-hmm. So from a hormone perspective, what's your take on delivery of hormones? Like the best way to deliver hormones. I know there's creams, there's troches, there's the pellets, and there are a few things in between there, I believe. What are y'all's, let's talk about the delivery
I think it's
methods.
Individualized care. I think that is truly what, the allopathic way is not teaching. It's individualized to the patient, right? So, a patch might be great for someone, but if you're an avid swimmer and you like to sauna, maybe a cream is better. There are multiple routes. And I think working again with local pharmacies, local providers that give, compounding pharmacies, working with, certain companies, drug reps, I think it's all an exciting way to provide the patient with something that is individualized to their needs, because not everyone's the same. We're not cookie cutters, someone who has no hormones versus someone who maybe is kind of estrogen dominant, it's a completely different picture. And so we have to work it up. We have to figure it out, and we have to see and it might not be the best thing after 3 months. We might have to change and trial and error. I think that's a lot of what is going on because we haven't been studied. We are the experiment right now, I guess. But it's a good thing because I think everyone's going to get what they need, and it's individualized.
And very conversational. So like, let's say someone comes in for a follow-up visit and they're like, this cream is not working. Well, great. Let's just change it and see. It's very movable, and we have very good relationships with our compound pharmacies and the pharmacists themselves. So if we need to do anything custom in a pinch, like that's no problem at all.
Oh, that's exciting. I got on a testosterone cream because my levels were kind of low, and unbeknownst to me, I was giving myself like quadruple the amount of cream, like a full-grown man amount of testosterone. So
it sounds like education is a big part of it too.
Yeah, I was roid raging for a few weeks.
My goodness.
Very emotional. So Ashley Ramsey actually was like, you do realize you're on like an enormous, like you're giving yourself way too much. So, oh, that's good. So learning and educating your patients is
yes, because it can be tricky, like when you're transitioning from maybe like a traditional form and then you're doing a cream. Yeah, like sometimes the instructions are like 1 click, 2 click, but that's why we'll clear it all up first. We can demo in the office, if we need to do it, just to make sure you're walking out with the right thing.
But also testing the levels, right? Like saliva testing is important to see what's actually going on in the tissues. And so, a pellet, might give too much. You have to test. You have to know exactly what's going on in the tissues because again, it's like symptoms versus lab. You're not just a lab value, but it allows you to see what's really going on in the patient. So I think just some of these non-traditional testing is really interesting. It's exciting. I'm like really getting into this space, and I think our patients are going to benefit from it.
What are the biggest barriers do you see to people approaching as a patient going into this type of situation? What barriers do you see as being problematic? Going from traditional medicine to something that's more
functional,
like root cause type.
I think for some of our patients, I think it's unfamiliarity because we've grown up in such a traditional Western medicine space that kind of shuns just the complementary medicine, even though the complementary medicine to me is evidence-based. Like, it's just not commercialized. It's not supported.
And I think in South Louisiana, we're probably like the last ones to start seeing these things unfold. Like, they've been doing this in other parts of the country for a decade.
And I think some of it too, because when you're in traditional medicine for so many years, and for example, you're being told your thyroid's normal and you've been getting thyroid tested every year and you've been told by 5 and 6 people it's normal, but yet like you're having symptoms that just aren't going away. And let's say you work out every day, but then everything you're doing, even eating clean, like nothing's helping, like that's very discouraging. So now we have an office where we're going to look at everything and we're going to probably tell you some things that maybe your other physicians told you was not what it was, like that's going to be eye-opening, I think.
Just also being open. It's hard to, understand or look into other cultures, right? Like Eastern medicine, sound bath is a great therapy. There's so many other resources that, as somebody who goes to a traditional doctor, like I'm just so used to getting a prescription after I leave. But, sometimes you just need music or a sound bath or a sauna to detox. And it's not just a piece of paper that you're taking to the pharmacy and putting another form of medicine in your body. Like music is medicine, socializing with your friends is medicine, seeing a therapist, getting expert advice from a dietitian. These are all forms of treatment that is not what traditional medicine teaches. And so I think understanding that you don't just need to take home a prescription at the end of your visit.
I think a lot of people have that kind of piggybacking onto that, the idea that the fix is the prescription. So the fix is the medicine. So this is my problem. And I've seen that change a little bit. So I've been in practice for 16 years. So over this time period, I've seen a lot of change. But early on and in other places where I practiced, the patient would go in like, this is the problem, and I need you to prescribe the fix for me. And so the idea that the person has the information, they have the fix, they just have to actually do the work to make life easier. And it's going to be hard at first because any type of change or transition is really, really hard. But once you transition, then it gets easier and you feel better and you can recognize that I did have it in me. I just need a little help and a little guidance. And I think that's the role that is missing, is that guidance to let someone know that you actually do have what it takes. The prescription isn't coming from an external source. It's just helping you to figure it out.
That's so beautiful, because even as a surgeon, right, like the heart tones are down. I have to go crash C-section, get the baby out. Like I fixed a problem, but now I'm changing the way that I'm thinking, right? Like now I'm presented with a patient. We get to know each other. We are trying to figure out this problem together. And we have to, your treatment plan is going to be different from your treatment plan. And I think that that's a really beautiful thing for me too, as the practitioner, that it's not just going to be a standardized thing. It's a new form of practicing medicine for me that I'm excited to delve into, to learn about, to keep shifting and changing and making it better for patients, because the traditional way just didn't fix me.
I also think it's like a mindset thing. So whenever you go to a provider like y'all and, okay, like I have these issues and I know that it's not just going to be a pill, you have to be in an action state to be able to make these things happen. And it is difficult to give up sugar, dairy, gluten, and life-changing, but it's hard. Sugar especially, it's so addicting. That's probably my biggest hurdle. But it's so empowering and it's so much more sustainable versus just taking a pill and you keep your lifestyle the same. But our world isn't designed for us to be healthy. The food that we eat, the stress levels that we're under, the constant dopamine hits, we're kind of, it's designed to work against us, really. So it's quite the physical and mental hurdle.
Yeah.
And I think what's unique about like both of us, because I feel like we've been through such a life journey with our health struggles and circadian rhythm disruptions and stress. I mean, we are fully equipped to counsel anybody because we understand your stress. We understand what it's like to be sleep deprived and not know where to go. And you've tried so many different things and you've tried so many different workouts, and then that's still not helping. Like I finally gave up gluten like a month ago, and it's like night and day. Like I have a lot less swelling, a lot less edema, but I had to be in a mental place to get there because I love gluten, but gluten does not love me.
Yes,
So
you and everyone loves gluten.
So I'm just, I'm ready to whip out the before and after pictures to my patients, be like, look, you could be like this. I understand it's hard, but if I can do it, you can do it. I'll give you a food list. Like we'll do it together. Like we'll check up on each other, like that type of thing.
That's where community becomes really, really
Yes,
important.
I was about to say,
'Cause if
like,
you feel like you're standing in a silo and you're the only one,
Yeah, you can't
it's
do
a
it.
lot harder.
it takes a village. We have to work together. I think health coaches are so important I really want people to figure out the why. Like, why are you coming to see us? Is it your children? Is it your spouse? Is it you want to live forever? What is your why? And that's going to motivate you the most.
And even community, like we want to touch people's lives. So, there are still a lot of like, I feel like isolated people, maybe like we're caught up in our jobs or family life's busy. But even if we could be the connection, like, on our Instagram, we're giving out messages of positivity. Like we don't want people to feel alone in this. Like we're ready to hold hands and give very real world advice. We don't want to give people plans that they're so overwhelmed they can't even follow, because that's not the point. I think like baby steps, I know I needed baby steps first to make any of these lifestyle changes, and it's taken a few years. But I've finally gotten to a place where I can say I'm feeling better, my energy levels are better, my skin is better, but it took a lot of trial and error.
Well, and that's another challenging part of the functional medicine, is that it's not a quick fix. It's not, it takes time, and it's not going to happen in a 3-month time period for most people where you just suddenly feel better. It's like, okay, I feel a little bit better and have a little bit more juice, so to speak, to keep trying to figure it out. But just like anything, the journey is the process. When you get to the end, it's great, but the journey is where there's so much self-exploration and self-discovery, and what you thought was impossible, and you felt like there's no way I can give up gluten, or there's no way I'll talk about food things like not snack at night. There's just no way, or there's no way that I can eat at the same time that I have my coffee or before I have my coffee. But when you realize like these things that felt so unachievable, you've achieved them and beyond, that's so much more empowering to keep moving in a direction that's going to be supportive. And then you work your friends and you're like, hey, this is what I learned, and this is what I do. And so we can spread the message like just woman to woman.
Yeah, I was thinking, just like it's kind of hard these days because our world is designed to keep us sick and all these things, it's also kind of the best time ever to be on a health journey, because it's normal to be on a health journey. And the social media, if you don't have the community in your life, there's so many ways to stay connected with people that are doing this too. And we have so many more food choices than we did before. I mean, my aunt got diagnosed with celiac probably almost 20 years ago, and it was like vegetables and meat or cardboard stuff, but today it's almost indistinguishable. Some of the gluten alternatives, a lot of it's garbage, but they have really good quality.
You have options.
Yeah. And just there's a variety to choose from, and there's so many different ways to work out, and it's just kind of a fun time to be a middle-aged woman.
I agree. We've had all these like Pilates studios popping up, so I get really excited. Like more options, and then like more saunas, and then we'll have one in our office, which I will be using it myself. So
yeah, just block off the an hour. So.
Yeah, it'll be fine.
I would love to have one, but I'll just go rent one once a week.
Yeah. So I think from an exercise perspective, it used to be that you walked, you ran, or you went to the gym. And now there are so many other options, to do like really intense to like more yoga, Pilates, style. There's just all different things that you can do. And each one of those you can build community within those things.
And I love that too, because we can work with our patients' cortisol levels too and determine like which workout is best for them at this certain time. And again, that's something I had to learn with myself, because my lifestyle was all about yanking up the cortisol, and then I would go run it off, and I was bodybuilding for a year. Like, what do you think my cortisol was doing? Like, I thought I was helping myself, but I was not. Only to realize that more Pilates, more bar work was going to be helping me instead of burning the candle at both ends. And now that I've gotten my cortisol in check, I can go back to running, because I still like running. It's just, again, running did not like me at that particular time. So it's an evolving process. Like, we may tell somebody, okay, running's not a good idea right now. That's not forever. It's just, let's let the body recover for a few months, and then let's reassess. And then we could start integrating these other types of activities.
I've also seen things where, especially for women that still like are not in perimenopause or menopause yet, certain workouts during certain like parts of their cycle where I guess you're ovulating, you have more energy, or you're luteal, you need to just do yoga. So that's a really fun puzzle to figure out too.
Yes,
for people.
yes. Cycle syncing exercises, yes, it has everything to do with energy and hormones. And, some of us have worse PMDD, worse PMS. Some of us are cranky when we're ovulating, and that all has to do with the hormone differences. So yes, we can tailor workouts to your cycle, if it makes you feel better, if we think that would work out. Now, all exercise does help balance hormones. It should be part of like the PCOS prescription already. But yes, we can work with your body and the timing of your cycles to come up with an activity plan.
What kind of supplements do y'all think are useful? Because there's so many. So just as a side note, I had a patient come in yesterday with what was the description was cinnamon gummies to help with diabetes. Okay. There's lots of red flags right there.
That's my favorite.
Lots of red flags with just that. But I looked at the ingredients and there was not cinnamon in the gummy at all. In the ingredient list, they didn't have any type of cinnamon.
Oh my goodness.
So, I mean, obviously there's lots of issues with that. But there are so many supplements. And of course, she just saw it on Facebook and she was like, oh, I have diabetes. Click, I'm going to order it. And so we had a good heart to heart about that one. But because we are inundated with supplements that are supposed to help, what supplements do you think are worth looking at versus maybe even some that are being discussed and talked about that are not really all that helpful?
So it's great you actually asked that question because we made a post 2 days ago on that very inquiry. Number one is an omega-3 because it has been researched so extensively to bring down inflammation. Inflammation is what's contributing to most of our chronic diseases. So if you had to pick just one, now Dr. Fashho may have like a different favorite, but mine would be an omega-3, but a quality one with a 2-to-1 or higher ratio of DHA to EPA.
I would say mine, I do love omega-3s. That has actually helped a lot with my issues, but also vitamin D. I think as a physician, looking at the optimal lab ranges, it's actually not optimal. We should be a lab range is only looking at the standard deviation bell curve. And I think we really need to be above what the lab is saying just because we're kind of indoors more. We're not getting taking a good vitamin D with the K2 is so important for absorption. And I think checking that your supplements are third-party tested, getting them from a reliable source, maybe not the internet. Talking to your provider, your dietitian, asking your friends what they take. I'm sure others have trialed and errored some brands, and, we are a community, and I think that it's important to share the knowledge. And so I would say vitamin D.
What are your thoughts on creatine?
It's amazing. Take it at the beginning of the day. It helps you make ATP, which is energy. It helps preserve brain function. And Dr. Fashho and I, we do have our favorites also. So if you're considering that.
It makes me drink more water.
Yes.
And for me, I'm not a pill swallower. I like chews and gummies, which I think it makes sense. Take what you're going to actually put into your body. So I did find some creatine chews that I like that kind of taste like Chalky Tums. But I've tried all the flavors and there's only one that I really like. But, everyone, it's trial and error. I really do believe that. And I think finding what's right for you might not be what's right for somebody else. I also just wanted to plug for when we were talking about sauna, how important detox is and going along with exercise and sweating, right? Like sweating, peeing and pooping are the only ways to get rid of toxins in our body. We're putting so much toxin in with our standard American diet, plastics, microplastics, chemicals that are pesticides. I think it's really important to our age group, to teach our children to do this stuff too. So exercise is a form of detox. So if you can't get in the sauna, get out there and sweat, go run or play a sport, optimize your gut health so that you can excrete drink your water so that you can pee it off. I think these are basic things that you really don't need to go get a prescription for, but maybe just a little gentle reminder from your community. And I think going to the sauna is great, but it's 30 minutes of your day.
Right.
Sometimes the most foundational things like drinking water, we've talked about this before, drinking water is just like so basic and foundational. We assume that everyone does it, and really it's not happening.
That's 90% of my triage visits in the hospital. Come in with a complaint of contractions or cramping, not in labor. How much water did you drink? Oh, I drank a bottle. It's
Everyone's
amazing
dehydrated.
Everyone's dehydrated. And so I offer, you want to drink some water or do you want it through the IV? And so I think, it's a basic thing that I think a lot of us miss in pregnancy. I mean, we're busy. We're trying to take care of other living beings. We're trying to get on with our day. And I see your water bottle there and I'm really jealous that I don't have one. That's great.
I carry this around and I probably still don't even drink enough water. Just actually, my husband and I were talking about this. As kids, I don't remember drinking water.
No. The water fountain, I was always in line and just waiting my turn and would just pretend take a sip. So I'm probably already baseline kidney issues, but
I think we've grown up dehydrated. So even teaching us to drink enough water, because I was always dehydrated as a kid too. So it's an effort, even for us.
Our kids are doing better than we are.
Yes,
because
sure. we've learned. So we're trying to pass that knowledge down. But yes, definitely water. And then, as you know, our lymph system, by us working out, your muscles actually act as a pump for the lymph system and also for the veins to bring blood back to the heart. So there's just so many benefits, even if it's just walking. Walking is life. So even if you don't want to go be a marathon runner, which no one is expecting you to, if you already are, that's great. But walking, just something that simple is enough.
Okay, so I have a debate that I want two doctors official decision. Vibration plates for lymphatic drainage. Effective?
So we went to a conference recently and we both got on one. And I guess I'd never been on one. There are studies actually that show osteoporosis prevention. And I mean, it took me back to the 1950s when they had that shaky thing. I'm there obviously was something back then that made women get on it, but it's a very similar principle. And I think, yes, it can be gimmicky, but I think even just going out and shocking your bones with walking is a very similar, inexpensive thing to do. But I tried it. I thought it was cool. I mean, would I remember to do it every day? Probably not something I'm going to personally incorporate, but there are studies that show it can really actually help your lymphatics and prevent or promote bone healing.
Yeah, there are studies for it, because I'll confess I'm the biggest skeptic about everything. Someone sends me a new vitamin, even when creatine became the buzz. I'm I'm not going to take that. I need to do a deep dive. I'm going to go look at all the research papers before I add another supplement. So with the plates, I really didn't give it much thought for the initial month when all of this started coming out. But it is proven in the research. And then getting on the plate at that conference, I feel like I felt different. I wasn't expecting it to work my muscles like it did. And it's going to be those very small spine stabilizers. So it's actually tapping in a multifunctional way. It's stability, it's spine stability. It's all the very small muscles that are very hard to work out. But then all that stress on the bones, that's helping. But, like Dr. Fashho already said, you can just go work out, do some resistance training.
For a subset of the population where you have perhaps just a woman who's maybe in her late 50s, hasn't really worked out or exercised much at all, doesn't feel super confident in their ability to go outside and walk without tripping, or just quite frankly doesn't want to sweat. There's a subset of people, and there's a lot of them. There's a lot of people that are in that little subset that I just said, where if they can at least get on a vibration plate, it's a place to start. And they start to strengthen muscles that they have not used in a while. And so that might give them, again, the confidence to say, okay, well, let's go walk around the block. And that's all vibration plate, walk around the block, vibration plate for 5 minutes, and then that's your exercise. Like that's the prescribed exercise right now. So I think there's a huge subset of the population that could benefit from it. If you're already an exerciser and you're already like moving your lymph and doing things, then it may not be the best investment, but I do think that it works really well for some people.
And for the indoor person, I think what would help to me is it created a sense of body awareness. So almost like I had to balance a little bit. And then once I got the hang of it, it just, I don't know. I feel like it helped me reform that mind-body connection because I guess in heightened states of like anxiety awareness, that's one of the first things to go. And it's one of the hardest things to teach.
And I'm like the multitask queen. Like I'll be riding the Peloton, typing emails. Like I think it's something that you can multitask, right? Like you can be making something on the stove, get on your vibration plate, watch the news, like all at the same time. So I do think that they're, again, individualized recommendations.
The millennial meme woman right now.
Right.
Like,
Right.
Sean will
With
send that
the
to
red
me.
light on the face
the
while
red
they're
light
on the
panel,
plate.
the vibration plate, like reading the self-help book, but who we are.
My son
We
actually
are.
took
Yeah,
a picture
created
of me
something.
the other day. I was reading a book. It was not a self. It was just a novel.
Fun book.
On the Kindle, a fun book. And I couldn't put it down, but I was also having to cook something. So I'm like reading my
amazing.
Kindle while I'm stirring something. And my son walked in. He's like, "What is happening?" I'm like, "I'm getting it all done. I've got it." So yeah, that
that's
was
what
a
women
real life
do.
situation.
Yeah,
I
feel
would
like we're
drop
so
the Kindle
busy
in.
now.
I'm an audiobook girl because I can't.
Yeah, we're so busy now. I feel like if you don't know how to multitask, it's like we just can't get everything done.
But that's part of our problem too, is the multiple layers of multitasking is,
Yes.
you know,
And then
fueling cortisol.
I wanted to plug too, like our PT colleagues, like, right, that's another place to start. Like physical therapy is so important. And, you know, I do think Aviva is something that we're going to tap into other resources that maybe traditionally, you know, postpartum, we now know the literature says physical therapy, pelvic floor physical therapy, seeking expert advice is really important. And I think that's what our patients will need.
yes, because thinking out of the box, being forward, like, you know, I think because this is our business, this is our baby, we can deliver the care that we think women really need in our own way. Why does like pelvic floor therapy start over 6 weeks after childbirth? You know, same thing with C-sections. Like, why is this happening when, like, let's say some of our like ortho patients, if they get a knee replacement, they start PT almost immediately. But yet here we have women with a newborn and, you know, maybe a giant cut on their abdomen or maybe some birth trauma in their pelvic floor. Like, why aren't we starting that earlier? And I feel like just we are in this space now to be able to deliver care when women need it and not when it's too late.
I tell patients, especially the OB population, you're drinking enough water when your pee is clear. So if your pee is yellow, obviously if you take a bunch of vitamins, your first pee of the day is going to probably be a little yellow. The B vitamins tend to tint the urine, or certain medications, methylene blue kind of makes it a little greenish. But if you notice that your pee starts to get clearer throughout the day, that's right on the money, I think.
I think another point of safety too, living in Louisiana, if you're sweating and cutting the grass, we do run into issues with people imbibing too much water. They get electrolyte disturbances because they're just replenishing all the sweat loss with water when they really need electrolyte. So, we have like, I don't know if I can say brands, but
Yeah.
okay, we have like Element and Liquid IV that does incorporate just natural amounts of electrolyte. So that
Coconut
can help
water,
avoid
I think it's so
coconut. Yes, that can help avoid
basic, but
Mhm.
Obviously watch the sugar, but coconut water is just
There are electrolytes like everywhere. So many different types of electrolytes, preferably not the Gatorade Powerade.
Well, I'm excited for y'all to start. Do you have an opening date, TBD?
TBD. We're going to say early fall, so maybe like August as a tentative. Open our doors, brand new space. We'll be in the oil center. It's a beautiful space, a customized space for our patients. We're so excited.
Yeah, it's true. Yeah, it's like truly custom, and I'm like so excited to get to the finished product, and just create an ambiance unlike anywhere else. And you're gonna walk in, you're not gonna know if you're in the health spa, or it's not going to feel like a sterile medical office.
That's great, because I feel like people get intimidated by that, and just making people feel comfortable is the first step to having them open up and solve
Like
all their
our waiting
problems.
room will have a countertop, so we're hoping to maybe incorporate food and
And community, like
and socialize.
on your lunch break, like come hang out at the at the little bar. Like we're probably gonna have like little beverages and things. Like just
nice.
still working on a few fine details, but then we'll have like the sauna room, and so you can detox from work.
Yeah.
Before you
That's
have
cool,
to go
'cause
right
we're not
back.
far from the oil center. So the oil center is right there.
If you can't find me, I'm detoxing
Right.
at Viva.
Got to be the bar.
Well, that's exciting. Thank y'all so much for doing this, and I'm very
Yeah, for bringing this to our
Yeah.
community, because we need it.
Yeah, and thanks for having
Yeah,
us.
thank you again. I think I feel like last time I didn't answer the question right, because I wasn't really. So you asked everyone, what does living vividly mean to you? And I really do think it's living your authentic self. And I think last episode I was maybe a little bit like hiding the Aviva. And so I didn't feel like I was truly being authentic. And there was something that just like made me pause with, that's what the answer I wanted to give, but I wasn't living it. But now I can actually say, since our announcement, since we're really trying to help ourselves and each other and our community, like I feel like I just want to be my authentic self for everyone.
We don't have to hide it anymore. Like we're doing what we've always wanted to do finally. Like
Yay.
It's going to be fantastic. I love a woman-owned business.
Yeah.
It's going to be so nice.
Yeah, me too.
All the fine details. Well, thank y'all so much for coming on again, and we're really looking forward to checking
Yeah.
it out.
Yes.
yeah, thank
Can't
you.
wait for the fall.
I know. It's coming.
Thanks for listening to Living Vividly. If you enjoyed today's episode, please leave us a review and subscribe. We'd love to hear from you. For more resources and details from today's discussion, check out the show notes. Until next time, keep living vividly.